Hello everyone, it's Dr. Ryan coming to you from my office again with another video review of one of the Step 1 Free 120 questions. Today we're going to look at Block 1, Question 8. I'll put a link to the question below this video, but on this slide I've got the key points. So this question describes a 50-year-old man who has 2 months of headache and dyspnea on exertion. His past medical history is significant for hypertension, and he takes only one drug, hydrochlorothiazide, and his blood pressure is elevated 180 over 105. And the question they ask you is, ophthalmoscopic examination is most likely to show which of the following in this patient? And we have 5 answer choices: arteriovenous nicking, melanocytes in the uvea, optic neuritis, posterior subcapsular cataracts, and tractional retinal detachment. Okay, well, this question is fairly straightforward. It describes a man with poorly controlled hypertension. His blood pressure is markedly elevated. He's only on one drug for hypertension, hydrochlorothiazide, and this is a relatively weak antihypertensive, and it's doing a poor job of controlling his blood pressure. Because of chronically elevated blood pressure, he has a headache, and he's developed some type of heart failure, so he has dyspnea on exertion. And so what they're asking you essentially is, what do you expect to see on an ophthalmoscope exam in a patient with poorly controlled hypertension? And there are about 5 or 6 findings in the back of the eye in poorly controlled hypertension, and you just want to nail these for your step exams. One of them is arteriovenous nicking, and that is the correct answer to this question. So when you examine the back of the eye with the ophthalmoscope, you can see arteries and veins crossing one another. In patients who have poorly controlled hypertension, the arteries can become thickened and they can cause the veins to become a little bit smushed, and you can see this. It's called AV nicking. Do yourself a favor right after you watch this video, search this up and look at a bunch of examples of AV nicking so you know what it looks like. Other things you can see in the back of the eye in patients with hypertension are microaneurysms, hemorrhages, cotton wool spots, papilledema. Make sure you know what all these things are. Make sure you know what they look like, because they can all come up on your exam. This question's fairly straightforward because they just give you AV nicking, but they could show you a picture and ask you to recognize it. So you want to not just know the name, you want to know what it looks like. All right, as to the other answers, let's go through them quickly. Melanocytes in the uvea, this is not correct. There are melanocytes in the uvea. I actually didn't know this till I answered this question, and they rarely turn into melanoma, but anything growing in the uvea would lead to vision problems, and this man has no vision problems. Optic neuritis is a common initial presentation of multiple sclerosis. It's inflammation of the optic nerve. It usually presents with vision problems and pain on eye movement, and this man doesn't have any of those things. Any type of cataract, including posterior subcapsular cataracts, would cause cloudiness in the vision. Cataracts are cloudy findings inside the lens of the eye. This man doesn't have any vision problems. And then finally, tractional retinal detachment is a type of retinal detachment, obviously. When this happens, the retina detaches, and there are vision problems which this man doesn't have. The most common type of retinal detachment is called rematogenous retinal detachment. This is what happens when there's a tear in the retina. Tractional retinal detachment is the other type. It's called non-rematogenous retinal detachment, and this can occur in patients who have diabetic retinopathy. It can occur if there's fluid in the back of the eye, but nevertheless, none of the things in this case fit with retinal detachment, whether it's tractional or some other type. And so basically, this is a fairly straightforward and easy question, and you'll be surprised on your step exams. About half the questions will be relatively easy like this one. They're not all going to be brain stumpers. Sometimes you'll think the question is so easy you'll think you're missing something, but you're not. There are going to be some easy questions on your exam. And that concludes our video review of the Step 1 Free 120 Block 1 Question 8.